Hello there, my name is Blessed Precious Onyinyechi. I'm a 400 level student of JPTS, Department of Healthcare Management and Nursing Practice. Today I'll be showing you the different steps involved in first aid and resuscitation using the DRABC acronym. The D there represents danger, R represents response, A represents airways, B represents breathing, and C represents circulation. So come with me as I explain what these different steps involves. First of all, danger. When you see a casualty, assuming you are with someone, you can just ask the person to dial the emergency line while you check around if there is any danger or anything that will inhibit you from trying to help out this casualty. As much as you would want to assist this casualty to come back to life or to gain consciousness, you also do not want to put your own life at risk or in danger. So once you have cleared that there is no danger around, you proceed to the next step, which is response. So you try to call out to the casualty to see if you can get any response from this casualty. You do something like this. Hello, my name is Precious. Can you hear me? Hello, hello. Once you don't get any response from this casualty, you try to touch and maybe pinch the earlobes to see if you can get any response. So you pinch the earlobes, you shake while you call the person. And if you don't get any response from this casualty, you move to the next point, which is your airways. You try to check if the airways of this casualty is clear, because that could be, if there's a blockage, it could cause or hinder this casualty from breathing well. So you try to check. What you do is you tilt the head backwards while raising the chin, and then you open up the mouth and check if there's any obstruction to the airway. Maybe if the tongue is lying against the airway or there's any fluid on the airway. You try to check for all of it. If there's a fluid, you turn the casualty sideways so the fluid can pour out. But if the tongue is lying against the airway, you can use your hand with your gloved hands, please. Use your hand to adjust the tongue and make sure that it's not obstructing the airways. Something that could also help you is an oropharyngeal tube that will help you determine the place, thereby creating a provision for air or oxygen to go in. After ascertaining that there is nothing clearing or blocking the airway, you can move to the next part, which is breathing. Try to check if the casualty is breathing. When you feel the chest or look out for any rise and fall on the chest, if you can't find any, try to listen or feel. Put your head very close to the casualty's nose and try to feel for any movement of air. You can do this for the next 10 seconds. So I put my face close to the casualty's nose and try to listen for any movement of air for the next 10 seconds. If I can't get that, I'll move to the next part, which is the circulation. So first of all, I will try to check around for any active bleeding, because I'm trying to prevent this client or patient from going into shock. So you check for any active bleeding. Once you've ascertained that there is no active bleeding, you check for the patient's pulse, the casualty's pulse. So you put your hands by the side of the neck for any pulse that will be felt. If you can't feel that, you perform a CPR, a cardiopulmonary resuscitation on the patient, by giving 30 chest compressions and 2 breaths. So you keep doing this until help comes. Thank you very much for your time and your patience. I hope to see you next time. Goodbye.